For only the fifth time in her 68-year reign, the Queen has addressed the nation outside her annual Christmas broadcast. She's paid tribute to the NHS and key workers keeping goods and services going amid the coronavirus outbreak, and said that when the country succeeds in overcoming it, that success will belong to us all. Barely an hour after the Queen's address, it emerged that the Prime Minister has been admitted to hospital on the advice of his doctors after having continuous symptoms of the coronavirus. More on that shortly, but first here's our royal correspondent Nicholas Witchell on the Queen's address.
From Windsor Castle, a broadcast by the longest-serving head of state in the world, a speech without parallel in her reign as Britain and the wider world face an unseen threat.
While we have faced challenges before, this one is different. This time we join with all nations across the globe in a common endeavour, using the great advances of science and our instinctive compassion to heal. We will succeed, and that success will belong to every one of us.
She spoke first to those facing the most immediate challenge.
I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home in support of us all. I'm sure the nation will join me in assuring you that what you do is appreciated, and every hour of your hard work brings us closer to a return to more normal times. Together we are tackling this disease, and I want to reassure you that if we remain united and resolute, then we will overcome it.
She praised the way people had come together to help each other and support the health services, and she thanked those who'd followed the government guidelines to stay at home. Our collective response, the Queen said, would define us.
I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say the Britons of this generation were as strong as any, that the attributes of self-discipline, of quiet, good-humoured resolve, and of fellow feeling still characterise this country. The pride in who we are is not a part of our past. It defines our present and our future.
She recalled her first broadcast as a teenager during the Second World War, when she'd sought to comfort children who'd been sent away from their homes for their own safety.
Today, once again, many will feel a painful sense of separation from their loved ones. But now as then, we know deep down that it is the right thing to do.
For all the current hardships, the Queen said, we would come through it.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again. But for now, I send my thanks and warmest good wishes to you all.
It had been an exceptional broadcast for an exceptional moment. Nicholas Witchell, BBC News.
In the last hour, Downing Street has said that the Prime Minister has been admitted to hospital in what's being described as a precautionary step. He tested positive for coronavirus 10 days ago. Our political correspondent Chris Mason is here. What do we know, Chris?
Statement published by Downing Street at 9:10 this evening. A Number 10 spokesman telling us that on the advice of his doctor, the Prime Minister has tonight been admitted to hospital for tests. The spokesman goes on to tell us that it's a precautionary step. The Prime Minister continues to have persistent symptoms of coronavirus, as you say, 10 days on after testing positive for the virus. He's been in self-isolation for those 10 days, remaining there, as is the advice, because his symptoms hadn't cleared up. We have seen and heard from him since he's been in self-isolation, including the other night, clapping on his own at 8 o'clock, as so many of us did, for NHS workers, and he's been continuing to chair cabinet meetings and carry on as Prime Minister from self-isolation. I'm told it was the persistence of these symptoms, including a high temperature, rather than a further deterioration in his health that led to tonight's decision. He was taken to an NHS hospital in London early this evening. It was not an emergency admission. A decision reached on the advice of his doctor. It was considered sensible that he could see doctors face to face rather than being consulted over the phone. He's expected to stay in overnight. Number 10 are describing the test, as I say, as routine. He is still leading the government tonight, Boris Johnson. He's in contact with ministerial colleagues and officials. But the Foreign Secretary, Dominic Raab, who is the first Secretary of State, is going to lead the government's coronavirus meeting first thing tomorrow morning. The Prime Minister, alongside the Queen, personifies, doesn't he, the country's public response to this pandemic, and he's experiencing the unpleasant reality of it.
Chris Mason, thank you. Well, earlier, the Health Secretary, Matt Hancock, said that it is mission critical that people obey the social distancing restrictions and that a ban on outdoor exercise is possible if they are flouted. The latest figures show that 621 people died in UK hospitals in the last 24 hours after testing positive for coronavirus. That's nearly 100 fewer than yesterday. The total number of deaths across the UK now stands at 4,934. Our health editor Hugh Pym reports.
Groups of people in London today, some sunbathing. It's not acceptable, says the Health Secretary. The official rule is that people should stay at home unless they're taking one burst of exercise or going for essential shopping. And he warned that if the public didn't act in the spirit of the guidelines, then firmer action would need to be taken.
We've included exercise as one of the things that you can leave your house to do, because exercise is good for our physical and our mental health. But please do not bend or break this rule. We can't rule out further steps, but I don't want anyone to think that any changes to the social distancing rules are imminent, because the vast majority are following the rules.
At the Downing Street news briefing, the latest information on hospital admissions in England was shown. After a downward move, the London figure has carried on rising, and there was a steep increase in the northwest. All other regions saw increases. Officials said the NHS did have the capacity to manage the caseload.
We still, as the Secretary of State has said, have capacity in all of our hospitals to manage these cases, and we're hoping in due course, if everybody continues to practice social distancing, that those cases will start to fall.
There have been recent urgent appeals for more ventilators for critical care beds. Ministers have called on manufacturers to step up production. The Health Secretary said there were just over 9,000 in the system, and the aim was to get to 18,000 ventilators. How many will there be there next week at a time when experts say the NHS will be close to or at the peak of demand?
I haven't got an exact figure for how many extra we will deliver next week, not least because when we bring them in from abroad, there are risks to the timing there and challenges to the timing. But I would expect many more over the next week. And the goal continues to be to keep ramping it up to the 18,000 target that we've set.
On the front line, many doctors and nurses are anxious about the number of coronavirus cases to come.
What I'm amazed by is how people are prepared to work right through that because of tremendous commitment to the patients and their profession and their colleagues. So it's been quite inspirational, really, but it is certainly in my career, 30 odd years, I don't think I've ever before come into work worried about whether I was going to get ill from my job.
Many different preparations are being made, including this temporary mortuary in Essex, which health leaders hope will not be needed. Lives will be saved, say ministers, if people follow the guidelines. Hugh Pym, BBC News.